Todd. Good morning, Sam. How are you doing this morning?
Good. How are you?
My name's Todd, and I'm a physical therapist for BJC Home Care Services.
Get started with your exercise.
Yeah, come on, let's go in here.
All right, sounds good.
With the home care setting, you get a wide variety of patients.
Back feeling okay?
Yeah, that's doing pretty good.
You get a lot of orthopedic patients, the total knees, total hips. You do get the cardiac patients, stroke, neuro, so really a wide variety of patients you get to see. Physical therapists will evaluate a patient, develop a treatment plan based on the findings of that evaluation to help improve their overall function, increase strength, range of motion, improve function in their everyday life, activities of daily living, as simple as getting up and down from a chair, getting out of the bed, getting in and out of their house. I spent 14 years prior to coming to home care in the outpatient setting. The beginning was in the industrial rehab setting and then in the private practice. I owned a business for probably 10 of those years and just decided to make the transition to something different.
Very good. 128 over 80.
Most patients have the basic stuff that they need to get started.
Get a hold onto the chair, and for the first
Stand behind
exercise,
the chair.
stand behind the chair.
If you've got a place to sit, we can do therapy sitting in a chair. If you've got a bed, we can do therapy laying in a bed. That's really all that we need. Any special equipment, we can take care of ordering. There may be times that we take walks outside because we need to make sure that they can be functional and independent. Getting to the mailbox, getting out to the car in the driveway, all those types of things are important that a lot of people don't think of when they're trying to get better, and we're trying to emphasize complete independence. A patient's family support is very important. We always are trying to figure out, who's available to provide assistance and what kind of assistance they can provide, and then we, try to integrate those other family members into the patient's rehabilitation.
Todd, having a little trouble figuring out exactly where this should fit.
The most enjoyable thing to me, coming from a busy outpatient setting, is the one-on-one care with the patient, because that patient is the only patient I have to worry about when I get there. I don't have to worry about any other patients and what's going on with them, just that one patient.
On each side, so you're in pretty good shape there.
A gentleman that when he first came home, he came home on a gurney and was put on his couch, and I came out there for the first time, and it was a struggle just for him to sit up, and by the time I left, he was walking with a four-wheeled walker, getting out and about on his own, out into his truck, going to the drag races that he loved to do, and shortly after that, he was completely independent with walking with just a cane occasionally, and back to work. So I mean, he was calling me when he was back to work and telling me how grateful he was for things. So that was one of the really great situations.
Give you a call, get another appointment set up for later this week.
There's multiple patient stories like that because you make a real big difference in all these patients' lives, really.